Welcome to the Neurorobotics Lab at the University of Freiburg. In this video, I will briefly present our paper entitled Multi-Kernel, Multi-Branch, Multi-Kernel CNNs for Clinical EEG Analysis, which was published in Transactions on Machine Learning Research. Electroencephalography is a non-invasive method for measuring and recording the brain's electrical activity using electrodes that are placed on the scalp. EEG has a high temporal resolution and is an accessible, cost-effective, and relatively user-friendly technique. Thus, it is a useful tool in clinical practice for diagnosing various neurological conditions. When EEG is used to identify such disorders, an important preliminary step is to classify an EEG recording as pathological or non-pathological. To do so, trained experts have to visually analyze the EEG recordings, which is very time-consuming. In addition, the EEG signal itself has some inherent challenges. For example, the EEG has a low signal-to-noise ratio, and it is a high-dimensional and non-stationary signal. Also, the EEG signal, as well as abnormal EEG patterns, vary from time to time for the same patient and also can differ not only between conditions but also between patients. So, due to these challenges, the inter-rater agreement among human experts is only moderate and has to be reported to be somewhere in the range from 82 to 88%. To improve EEG classification, various deep learning methods have been proposed over the last few years, and studies reported classification accuracies to be in the narrow range from 79 to 87%. However, these results are limited as the majority of these studies have focused on one small dataset, the TOH abnormal EEG corpus, so the performance was evaluated on a small, less diverse set of patients. In addition, most of the CNNs proposed previously used single-scale convolutions, which are less capable of handling individual differences within the EEG signal. To address the challenge of EEG heterogeneity, we propose a novel architecture called Multi-Kernel, which has 5 temporal kernels and branches within the first block. Each branch employs a temporal convolution layer with a different kernel size that was defined considering 5 clinically relevant frequency bands, namely delta, theta, alpha, beta, and low gamma. To demonstrate the efficacy of our method, we evaluated the Multi-Kernel on 2 public datasets for general EEG pathology classification. In addition, we compared the performance of the Multi-Kernel to 5 baseline architectures and also with previously reported results. We performed several ablation experiments to investigate the importance of using multiple temporal kernel sizes and multiple branches within the first block of our model. We also analyzed the learned features of the Multi-Kernel using UMAP and performed an amplitude gradient analysis to determine how sensitive the Multi-Kernel's predictions are to amplitude changes across different frequency bands. Our Multi-Kernel achieved mean accuracies of 87 to 88% and mean sensitivities of 83 to 84% on both test sets respectively, and thus outperformed 5 architectures used as a baseline, as well as previously reported state-of-the-art deep learning approaches on these 2 datasets. In addition, with mean accuracies in the narrow range from 87 to 88%, our Multi-Kernel approaches the upper limit of the inter-rater agreement among human experts, thus bringing deep learning-based general EEG pathology classification closer to human-level performance. Also, an improvement in evaluation sensitivity further demonstrates practical gains of our method. Our ablation experiments show that using both multiple temporal kernel lengths and multiple parallel branches in the first block of our model significantly improved the performance, particularly in terms of mean accuracy and mean sensitivity. The UMAP visualization showed that the multiple KNet forms distinct and compact clusters of samples from the pathological and non-pathological classes. In addition, the amplitude gradient analysis showed that the model's pathological prediction is sensitive to localized patterns of amplitude changes across different frequency bands. These patterns align with current neurophysiological knowledge for pathological EEG patterns and also with the pathological patterns that have been identified by human experts in the corresponding clinical EEG reports. Overall, our study demonstrates that multi-branch, multi-scale CNNs, such as our multi-KNet, offer promising capabilities for the accurate and reliable classification of general EEG pathology. Future work should assess the cross-institutional generalizability, validate the multi-KNet in real-world clinical settings, and also evaluate the practical adoption and usability of these networks.